A major drug bust by York police revealing drug dealers have been exploiting Health Canada's medical cannabis system to fund a criminal network. Now, something that has happened before, and now police are concerned over the lack of enforcement from Health Canada. Drugs, guns, and cash amounting to $45 million seized. Dealers abusing legal marijuana licenses obtained through Health Canada. Police say this was done by manipulating addresses when applying for a license.
Subdivide that address without a township knowing into Unit 1, 2, 3, or A, B, and C, and then that allows them to continually stack those licenses.
That begging the question, just how could this happen? Some experts arguing there are complex gaps in the system that they say could be due to Health Canada granting licenses in good faith.
Now you need to declare that you have not been convicted of a cannabis offense at any point in the last 10 years if you want to grow for yourself for a license or grow for someone else. But there's still a question if Health Canada is not verifying the accuracy of that information or if they're not running records checks.
To the point where massive amounts of drugs, as we saw today, could go unnoticed. Is there anything more that Health Canada can do in order to make sure that things like this don't happen?
Well, I think it's a balance between enabling people to get licenses and putting what resources they can towards both processing and reviewing licenses, as well as everything else Health Canada has going on with the new marijuana legislation. So I would expect they're doing their best, and I think the reality is no system is perfect.
A lack of enforcement, police say, is becoming problematic, especially when these licenses are being abused by the wrong people.
It does frustrate us, but like I said earlier, is we continually have communications with Health Canada to point these out, and we're in a stage right now with the legalization of cannabis. The government committed to a 3-year review. We're already almost a year in. It's something that we continually talk to them about.
We reached out to Health Canada to see what gaps need to be addressed. In a statement to City News, they say Health Canada enforces compliance with the cannabis regulations. When the department is made aware of a potential issue, officials reopen the file in question and review all relevant information to determine whether there have been breaches in regulatory requirements. If deemed necessary, the department may also conduct an inspection of the registered individual's or designated producer's site. And we also reached out to Minister Bill Blair's office. In a statement, they say in part, we have taken additional steps to support law enforcement by providing access to Health Canada's dedicated 24/7 phone line, as well as investing $113.5 million to ensure organized crime does not infiltrate the legal system and prevent cross-border transport of cannabis.